When you started your career, you started it 2 decades ago. So the cases which were there was quite different than today. So how do you see such kind of situation?
For the layman or for a patient perspective, I think both are equally important.
Welcome to the Healthy Talk Show, where real talks meet real health and real change. Today, orthopedic doctors across the world are seeing something alarming. People in their 20s and 30s are already showing signs of joint damage, ligament injuries, and early degeneration that were earlier seen in people 15 to 20 years older. And in today's conversation, we are breaking this down in detail. First, the everyday habits that are harming your body without realizing. Second, the truth about gym injuries and whether you are training the right way. Third, a simple understanding of ACL and meniscus injuries. Fourth, when pain becomes serious and cannot be ignored. Fifth, the reality behind supplements and whether they actually work. And the last one, the biggest myths around knee replacement and modern treatments. To answer all these detailed questions, today we have with us Dr. Vinay Kumar Aggarwal, an internationally trained orthopedic surgeon with over 20 years of experience, trained in India and United Kingdom, and a specialist in knee and a specialist in joint replacement, sport injuries, and who can help you to understand it better. Doctor, welcome to the show.
So before we dive deep into this, as in the introduction, I said that you have an experience of more than 20 years. You have not only been trained in India, but also in UK. So what thing drive you to come into one of the specialty which deals with the most of the physical joint things, orthopedics?
Thank you, Ritika. Thank you for this lovely introduction. And thank you for touching on this very important topic, which is affecting like an epidemic in the today's world.
Yes.
It's affecting a lot of people. And as you rightly said, that it's affecting not only the elderly, now even people coming in 20s and 30s are having these joint problems. So coming back to your question, yes, I have been trained in India as well as I've been trained in United Kingdom. There is a difference in practice, but the principles remain the same. The treatment there is more rationed because it's National Health Service, okay, which is government controlled, whereas in India it's primarily private practice as well as some government setup. So coming to your question of why I chose orthopedics, yes, I always wanted to be an orthopedic surgeon. Orthopedics is now not only a study of bones, it has evolved into complete musculoskeletal science.
Yes.
So it involves a combination of treatment of bones, joints, ligaments, tendons. So it is a wide variety of plethora of services. And it's quite gratifying to see patients suffering with problems coming to us in pain and distress, and they're going back happily. So I think that what drives me to perform what I do.
So when you started your career, you started it 2 decades ago. So the cases which were there was quite different than today. So how do you see such kind of situation?
So orthopedics as a branch has definitely evolved, and especially over the last 2 decades, it has shown a massive advancement and massive spectrum has increased. Earlier, like in the early 2000s and 90s, the branch was primarily limited to trauma services. We used to offer nailing and plating and trauma treatment to most patients. The awareness about concepts of joint replacement, arthroscopy, sports injuries was less. But over the last 2 decades, and especially the government's push over sports injuries, there's a massive evolution and awareness about people who are going to gyms, who are playing sports and are coming back to us with their injuries or with their problems. And that has kind of, evolved. The science has evolved. Newer technologies is coming. So I would say the orthopedics, as I earlier said, orthopedics is not a branch now confined to bones and joints. It is a branch which confined entire musculoskeletal system. So it offers a wide range of services.
Yes. If I say so, let's be very honest, and I can say brutally honest. I think we are the first generation who are seeing this systematic dysfunction in our, you can say, joints and in bones, anything. Because nowadays, around 20 years or 30 years of people are having pain, not only in joints but in back. They are having ligament issues, they are having knee replacement, shoulder replacement, and I don't think so how many kind of replacement. So how you are seeing such kind of different kind of you can say dismentation of system? What is leading this? Is it the lifestyle or something which is making this cause to happen?
Yes. So it's a very, very valid point you have put up. And in my experience, I have seen that definitely the spectrum of disease I am seeing is much different and much younger, which I used to see in the earlier part of my practice. I would say the most important factor for this is definitely the over reliance on social media, the computers, the internet, and majority people are now some form of desk job they are doing.
Yes.
Whatever we do, whatever job we have, whether it's any industry, there's a lot of paperwork in terms of computer work. There's a lot of social media involvement. There's a lot of to do in on computers, sitting, and laptops and phones. So the major cause I would say is younger generation and also peer pressure. You see, there's a lot of peer pressure on younger generation to perform. There's a lot of targets to reach. The companies are, the salaries have increased, the things have increased, but definitely targets are also increased. So the body is, and moreover, the physical activity of people, unless they are really into sports or anything, the physical activity has quite come down because we are living more in comfort zones. So the traveling time, we are commuting with metros or cars or bikes or whatever, the walking is decreased unless we are actively pursuing some walking. So all these factors, as you rightly said, it's a lifestyle problem,
Yes.
occupational problem, and that has caused two problem coming in the younger population.
So do you really think so that not only to the younger people the lifestyle is changing, but also in the older people?
Yes, definitely the older population, first of all, longevity has increased thanks to medical science and awareness of diseases and preventive checkups and medicines which have come up in the market. The longevity has increased. Earlier we used to think that 60 is old. Now we see 60 is middle age, and now we consider old as octogenarian, like more than 80 and 90 we consider old. So the longevity has increased. The older population is now more educated, more aware. So they are living longer. They are also more active. So obviously they are coming with more problems. So I would say that in a way it's a good thing that longevity increased, but then obviously diseases also increased, and also so are the solutions. So we do have the solutions for both the populations.
So sir, in the answer you said that nowadays you can say not only the Gen Z but all the mid-age people, whether they are of 35 age or 40, they are having sitting job. So do you think that sitting is a new smoking of orthopedic things?
Yeah, I mean, I would say that's a good word, your point. I think yes, it's definitely a lifestyle problem. Sitting is unavoidable, but the problem is that the prolonged sitting and prolonged bad postures, which we obviously, when we are in a particular job, we are doing a particular task, we are kind of forget that we do have a back, which is a living structure.
Yes.
We do have a legs, which are living structures.
Yes.
We just forget to exercise them or give them rest or give them good posture. And so sitting itself is not bad, but the problem we face when we see people is that they are just not inclined towards change of posture during the work. They don't have awareness about how to sit, how to use the desktop properly, laptop properly.
Yes.
And also then the lifestyle as a whole is more sedentary. So I would not say just sitting is a problem, but overall the awareness, overall the lifestyle is poor, bad habits, I would say. And then obviously late night snacking and processed foods and all these things also are contributing to a lot of problems.
You have the expertise in sports injuries as well, sir. And nowadays what people are doing, they are sitting for 8 to 10 hours, and after going to home, they are heading towards gym and lifting up heavy weights like 50 kg or whatsoever they are taking. So do you really think that sitting for such a long hour and then going to the gym and lifting such kind of heavy weights are not only giving damage to their ligaments, bones, but also to their whole body?
Yes, you rightly said. I think there is a lot of peer pressure and there's a lot of misinformation in the market. I would say social media has contributed to good things, but at the same time there's a lot of misinformation, unverified information. People come up to the media and they say anything, and then people start following it and more again. So this is a lot of problems. People confuse between strength training and activity. They're entirely different things.
So could you please, for our audience who are not aware of strength and the normal activities? Could you please decode this for us?
So I would say exercise medicine, when we talk about exercise medicine, it is majorly of two, you can say, you are working on two major aspects. To broadly, for the layman purpose, I would say there are two major concepts. One is that you are working on a cardiovascular health.
Okay.
That is making a healthy heart. So how does the heart become healthy? Heart becomes healthy obviously by activity. Whether you walk, whether you run, whether you jog, you cycle, you swim. So these are isotonic exercises where the heart pumps more blood and heart has to work. And these are the most important exercises which are recommended for being on the healthier side. So if you're just doing these exercises, you can be healthy. Second part of the exercise, people sometimes get confused, is that they have to lift weights. You see, lifting of weights is called strength training.
Okay.
So we recommend strength training after especially 30-35 years of age, because our peak muscle mass reaches a plateau around 30 to 35 years of age. After that, our muscle mass starts coming down, especially in females, because obviously females have a cycle of when they enter a menopausal phase between 45 to 50. So these are the age groups up to 30-35 when the peak muscle mass reaches, and then it starts coming down. So we do recommend that you do some form of strength training. Strength training means that you lift some light weights so that the muscles work and they produce more muscles, or the muscle fibers increase in size.
Okay.
But what people start confusing with strength training is that they start under peer pressure or wrong guidance, they start doing massive lifting. And what happens is that when they do some lifting and randomly, what happens is that their muscle mass, their diet increases. So unless you are maintaining that level of lifting and you are being active equally importantly like running and all, that is okay. But when you leave that, your diet continues to high and then start putting obesity.
Okay.
So that's the root cause of obesity. That's why obesity is becoming an epidemic. And it's not that people who are going to gym are not obese. They are also getting obese because they are not understanding that it's just not brute muscle mass, because when you keep on lifting, the muscle keeps on growing and the energy requirement, the food requirement also keeps on increasing. So unless you maintain that level, which is not possible, throughout 24/7 round the year, it's not possible to maintain that level of activity.
Yes.
The body starts making muscle into fat, and that's the root cause of obesity.
In your whole conversation till now, you are mentioning one word, that is peer pressure. And I just want a 30-second reply from your side. What you want to say to the people who are just heading to the gym, making their body and giving the strength training and taking much diet into themselves and saying that we are taking strength, that's why we have to make it more applicable for the diet. So what will be the 30-second output from your side as an insider?
So in 30 seconds, as well, I would have shared you a story of one of my patients who is an Instagram influencer. I know he came, so I'll just take more than 30 seconds just a bit. So he came to me. He's absolutely perfect gentleman, young, smart, perfectly slim and everything. And he just came to me that I have got this, my muscle curve is a bit faulty. I said, how do you assess that? Because when I'm using my high definition reels, I'm making my camera, high definition camera, some of my peers have pointed out, in my comment section, they point out that your muscle is a bit rounded or a bit flattened. So, this is the thing, cameras are advancing, high definition cameras I would say don't go for high definition, go for high imagination, that would be my take on it. Don't go for, because ultimately, see, if you keep on seeing in the camera lens, everything, every nook and thing, we all have some faults, some, this and that, curves and that. But now people are showing everything on social media or everything to peers because of high value cameras and all. And even small, minute things are being noticed, which are irrelevant. Just absolutely irrelevant. So this is one example of peer pressure. Whether you are on social media, whether you are in gym, again, gym, the same thing happens. If you are someone who is statutorily stronger, who is stronger built, or has been working out for a longer number of years, he would be lifting 50 kgs. Then you will be pressurized to go for 50 kgs, which you don't need it. Yeah. Your body is not like that. You are a slim person. You just want to be fit. So people forget the target that is they want to be fit. They don't want to go to Olympics for weightlifting.
Exactly.
So there's a difference.
And so when they do such kind of lifting or something, then our body is so reactive that whatever is happening inside our body, some kind of signs always our body gives. But being a human, we always make the errors and we just ignore it.
Absolutely.
So what are some of the signs which we should not at all ignore?
So if you talk about gyms, if you talk about people like the working class, like people in the Gen Zs and also people in up to the middle age, I would say that who are in work and they go to gyms. So early signs I would say is that again, the simple joint pains like early morning stiffness they are having, muscle soreness which is not going away, which is just not cramps. If they are getting regular cramps in the like people who get a lot of cramps, if they keep on ignoring it. Sometimes people in their 20s and 30s are now coming with joint pains, knee pains. Again, sometimes it is genetic, sometimes it is wrong exercises or wrong things. Again, yoga, sometimes people they go with acute acrobatic posture. You see, you can't be a very good yoga expert over Ramdev in a day. You have to be
it's a long process.
It's a long process. Muscles have a viscoelastic property. When you stretch them, they take a while to get relaxed, and they take a while to relax. It's just like learning will not happen in a day. So similarly muscles also. So don't go for that he's doing or she is doing or my trainer is asking me.
Yes,
you have to understand your own body. You have to understand your own pace.
Do you think that trainers also do some kind of mistake in influencing their mind?
I won't say generally, I won't club all trainers in one go, because that will be a bit harsh on the trainers.
Yes.
They do the best for their clients or for their athletes or students or what I would say. But again, they sometimes go overboard, I would say. Sometimes they get really enthusiastic, and then again the vicious cycle of lifting and bending and whatnot starts, and they forget that ultimately that person has come for fitness. He has not come for being some form of a strong athlete. So there has to be balance. We have to fix our goals. We have to understand that we don't want to go beyond that, because we have our work to do. We are only come for fitness. What we start forgetting is that we start blindly doing certain things which sometimes lead to injuries, and sometimes it is very bad injuries.
And people always have some kind of habits which are very, you can say, slowly, but yet it is, you can say, destroying our posture, destroying our bone strength, our bone, you can say, longevity. So what are, you can say 5 habits, if I say it, are destroying in a layman, which they are doing on the daily basis?
So first of all, you're a woman, so I would talk about first thing is in women, I would say, and it's not only a habit, I would say it's a recommendation, that women must focus on bone health, because osteoporosis is an epidemic now, is going in rapid proportions, and that happens because it's not about exercise. You see, exercise medicine is a branch in itself. It's a subset of orthopedics and called exercise medicine. So the right advice is not coming. The right advice is, like you see earlier 90s and all, you remember people used to skipping, stair climbing. These have just vanished. People who don't know what advice is.
But nowadays, what I am listening to, sir, because I also scroll some kind of information in the Google. So they say that doing skipping on everyday basis is also harming your knee. Is it true?
So again, coming to the same point. See, no exercise on everyday basis. So we have to divide suppose we exercise 5 days a week or 3 days a week. One of all is that we have to give rest to 1 or 2 days in a week if we are not a professional person. Even for athletes also we advise some rest in a day, in a week. Secondly, we have to divide our day that one day we are working on cardiovascular thing. Cardiovascular means running, skipping, all these things. They are more of cardiovascular things. Skipping I mentioned for women, because skipping, when you load the bones, when you come down like running, jogging, skipping, stair climbing, the bone formation happens. This is the basic principle of bone formation, that when you load something, when you like a thumping thing, bone formation happens. And more you skip or more you jump or all these activities which involve thumping, there is more bone formation. And this should happen before your menopause kicks in. Because if you do not do these exercises, then the chances of having osteoporosis after menopause is higher. So that's one thing. Again, not saying daily skipping. Skipping can be also nowadays. There's a lot of parks also, MCD has created parks where there is a soft turf, that black mat.
Yes.
So I don't think skipping on that black turf or soft mat or on a grass is harmful. Again, you have to be judicious. Okay, if you have a knee issues, then obviously don't do a lot. But yes, this is one of the exercises to be recommended.
And one is the mantra: you should first know your body.
Absolutely.
If your body is adapting that, please go ahead. But yes, you should side by side take some kind of clinician health or your recommendation from your consultant.
Absolutely.
So coming back to the question which I asked you, sir, what are the 3 to 5 habits which are destroying people's bone health?
So first of all, I would say sitting, especially prolonged hours, because sitting kind of, it's when we do not take breaks, the muscles go in a deactivation state. The muscles get deconditioned, and muscles and bones are quite interlinked. So if the muscles get weaker, there's a lot of pressure on the joints, and then that leads to joint damage. So that is one of the habits. And I will say substance abuse. We cannot shy away from the fact that we are living in city life. There are a lot of substance abuse, smoking, alcohol, all sorts of things. They do a lot of damage to, because they generate free radicals in the body. So they damage the bones. They damage the absorption, metabolism. Third thing I would say is being indoor. Being indoor is definitely harming us a lot, and we all realize nowadays that a lot of things we are even sports are now being played indoors. Because the outdoor sports is very important, because the vitamin D formation happens in sunlight,
Yes.
and if you're just not going outdoors, or you're not going outdoors enough, or you are just taking a night stroll, the lot of things which normally body would make inside because of sunlight and fresh air,
Yes.
they are not coming to you. So being indoor, I would say, prolonged sitting, I would say, lack of rest, I would say. And another thing with professionals I'm saying is the lack of sleep.
Lack of sleep.
Sleep is a very, very important parameter which we are just not discussing anymore, because lack of sleep, poor sleep, or not getting enough deep sleep is no doesn't there's a hormone called melatonin which is generated in the body when you sleep well, and that hormone is not generated, so your muscle growth, your body anxiety, everything is up in the air. So when you are not getting enough sleep because of work pressure or whatever societal issues or work pressure or late night habits or late night snacking and all, so the sleep deprivation is causing a lot of damage to bones, joints, as well as mind. So these are the few things I would like to say.
And one last question from the gym culture only, sir. How do you recommend people to do deadlifting and squats? Because nowadays there is no age limit. Anyone who is heading to the gym, the next day they start doing deadlifting, squats, which in my perspective, I think somewhere it is harming their bone.
So deadlifting, you see, I personally, I don't, I don't think deadlifting is of any particular use in terms of, deadlifting is good when you are, doing professional training, or because deadlifting particularly puts a lot of load on your spine. You put a belt and everything, and you start, and as I said, it's not about just the weights, it's about the progressive weights.
Yeah.
Because you just can do a challenge that I lift this much, and I lift this much. So deadlifting, if you are just going for for this thing, fitness and all, and you just want to look good in shape, and I don't think deadlifting is at all necessary. And I've seen majority people who have come to me in OPD from gym are some form of they are doing deadlifting or something, and they have something done wrong to the back. Squatting, you see, squatting is a very good exercise generally, but what is happening in the city life, and I would say comparing to 90s and now, people are generally heavier. Like people like our elder generation or your grandparent generation, people were only on the slimmer side. An average weight of a male would be 60, 65, 70 kg, and a female would be 40, 45. Now on the heavier side, we are all 90s. No, this is normal weight now. So squatting is a very good exercise for the quads. Yes, the quadriceps muscles of the knee is a very good exercise. And squatting like Indian style, toilets used to be there. We used to squat on that. It was good, but now because of heavier weights of people, squatting is actually harming the joints. We are seeing a lot of knee damage occurring in especially Indian population, because people are getting heavier and then they used to squat.
Yes.
Whether they are squatting by virtue of their lifestyle at home, toilets, and sitting at habits of squatting, or gym. So I would say don't squat, but I personally recommend my patients or whom I want to build their quadriceps to do half squats. So you can go for half squats, control the weight. You can go for wall squats, and then see how your body responds. It's a balance between fitness, knee health, and quadriceps muscle strengthening.
Very well said, sir. There is a very thin line between these things.
You have to see customize. If you are having a knee issues, obviously you don't you won't squat. But yes, if you don't have any knees, then I would say I'm not a blanket ban on squatting. That's my recommendation.
Yes. One proactive question which has just come up in my mind: is the gym actually helping people or injuring them more?
So that's a being a devil in the room. So I would say that I won't say it's harming people. If you don't have gyms, then the avenues of exercising are very less. You see, especially in cities like Delhi, and if you without any coastline, without any sea and everything, there's not much to do. You see, after work, you see what will you do if you don't have a gym? You can't just stroll in the night, and just beyond a bit of talk that if you go just walk on the streets of Delhi in the night, you can always be bitten by a dog. So something like that. So something indoor is required where you have a people you have a like-minded people whom you can socialize, and you have a motivation to do.
Yeah.
So I won't say gym culture is wrong. Gyms are important, and gyms have definitely played a role in the. But so what, something has gone wrong in that, as I said, understanding. We are getting into that pressure thing, that thing, that competition, which is not
Yeah.
right. We should just understand your body, go to gym, do simple exercises. That's more than enough.
Yes. And one question out of this only: what is worse, no exercise or incorrect exercise?
I would say both are worse. Okay, no exercising is not a solution. We have to exercise, especially today's world where you have all people have some form of jobs, and those days are gone when the lifestyle itself was active. Like people in the earlier days, cooking involved a lot of exercise, and people used to get something from the market. They used to walk. So nowadays, because of the comfort in the society as a whole, like cars and everything, I don't think not exercise, not an option. We must exercise. Everyone must exercise regardless of the age group. Yes, incorrect exercise is equally dangerous, because if you go for incorrect exercise, then you land up with injuries. Injuries which sometimes are treatable, sometimes you land up with very bad injuries, and then progressive problems. So I would say both are wrong, and be judicious, I would say.
Yeah. Nowadays, sir, we hear two terms, and mostly I personally hear one of them, that is ACL tear and meniscus tear. So I think there are a lot difference between these two, which our audience don't know deeply about it. So I want you to please start with the very simple definition of what is meniscus tear, what is ACL tear, and what is the difference between these two.
So knee, when we talk about the knee joint is a joint which is formed by two bones, the thigh bone and the leg bone. And between these two bones, there are a lot of ligaments which stabilize. Just like two things when you attach together, so you have to have something which is joining them. So they are the ligaments. So one of them ligaments is an ACL, which is the anterior cruciate ligament. Other one is PCL, which is the posterior cruciate ligament, and the two on the sides too are the MC and LCL, that is medial and lateral cruciate ligaments. So these four ligaments primarily stabilize the knee joint, which prevent the knee joint from going forward, backward. That provide a stability. Sometimes with injuries, with incorrect landing, with accidents, with whatever whatever mechanism it may be, sometimes these ligaments get injured. When they get injured, usually the side ligament, they sometimes heal together on their own. But if the ligaments get completely ruptured, they do not heal on their own, and they make the knee unstable, and then you need to consult a doctor for the further treatment. Meniscus is a structure, it's like a shock absorber, just like a car has a shock absorber. So meniscus are like discs which are between the two bones of the knee joint, and they act like a shock absorber. So when the knee joint moves, when we move the knee joint bending and flexing, the meniscus transmits the forces from the thigh bone to the leg bone smoothly.
Okay.
So sometimes with injuries, meniscus also get damaged, but meniscus is a very important, and that's the advancement which has happened. You see, in the 90s and 2000, earlier part of practice, meniscus was considered as a redundant thing.
Okay.
As people who were not aware, used to just remove the meniscus when it was injured. Nowadays, there's a lot of focus in sports medicine about preserving the meniscus. So any patient who has come to me with a meniscus tear, I have almost always done a meniscus repair, because meniscus is a very important structure, because once you remove them or once they get damaged, the knee goes into a progressive arthritis.
So as you said, it is very important, one of the important parts of our body. So what are some of the things which make them tear?
So one of the things, as I said, if we talk about a younger population, as I said, like 20 and 30, when the meniscus are healthy, but when we land improperly, or when we fall, or some wrong techniques in the gym, some sports injury or some accidents, the meniscus can get torn. It's important that, because these things are not very overt. Like sometimes people have pain and swelling, and if they keep on ignoring it, it will come down to like a subtle pain. They will keep on having some pain, but they keep on ignoring it. Sometimes people come to us very late, that they have had a meniscus tear 2 years back, and now they're coming very late. The meniscus is completely knackered, completely frayed, and now we have to do certain salvage procedures. But it's important that if you have constant knee pain after certain injuries or certain twisting and turning, or you went to trekking and you had an injury, come back early if you have a constant pain, because that's a time when the meniscus is fully preservable. So these are the things you have to remember.
So these two are very similar. If I say from a layman perspective, you people know it very in a terminology way. These two are the tears, and when it is hurt, they show some kind of, you can say, signs. So how people will differentiate whether it is the meniscus tear or any kind of ACL tear?
So important thing is that for the layman or for a patient perspective, I think both are equally important. I won't say meniscus is more important than ACL or vice versa. If you have an injury to the knee, if you have certain problem in the knee, if you have a swelling, if you have pain, it's important that you come to the doctor and get a diagnosis made, whether by MRI scan, whether by investigation, some ultrasound scan or X-ray or whatever. Some investigation has to be done and some assessment has to be done by the doctor to make a diagnosis. If it turns out to be meniscus or a ACL, again it's a doctor's discretion. It's a quite a subject matter of it's an expertise subject matter, that whether that patient needs some form of treatment or whether conservative management can be done, some physiotherapy can be offered. But it's important that if you have symptoms of pain, symptoms of swelling in the knee, any injury which has caused swelling in the knee or pain in the knee which is not going in like a couple of days, 3-4 days, then don't be shy in consulting a sports medicine or orthopedic surgeon.
Do you think that this misinformation are the false security of taking the supplements?
Absolutely, yeah. You see, nowadays anything can be packaged, and then you start advertising that I took this because then I became stronger. It's like advertisement.
Yeah.
So you should not fall prey to, especially when it's health matters. Okay, sometimes you like buying things and all, but then if you're taking it inside, you have to be judicious, because anything excess can be damaging also. So you have to be judicious. There is always counseling available. There is always diet plan can be calculated. Your normal diet is usually enough. If you are taking a good balanced diet, it is usually enough for covering of your needs. Sometimes balanced diet is not enough possible, then you can take some supplement, but again for a limited time, not forever.
Do you think that people are wasting their hard-earned money on some kind of misinformation things, just getting the supplements or any kind of protein powder to give the nutrition or you can say the right diet to their bone health?
So, see, money is very subjective. If they want to spend on something, they can do. But again, as I said, something more important than money is more important that you are taking something for your health. So just by buying it and just by having it without any qualified advice, without any proper advice, if you are taking it, you are harming more than your money. You're harming your body. That is irreparable. Money you can earn, but body once damaged. So again, as I said, supplements are there, but don't fall prey for all the misinformation, all the things that are available in the market, which may not always be good. Be judicious. See what first of all is the balanced diet. Balanced diet is most important. The most sources of things are available in the diet. A good amount of exercise, sunlight exposure, and some supplements are usually enough. And again, it's your choice that you suppose you're exercising. Then I would say someone who's exercising, then the protein requirement go to 2 grams per kg. So these are the things. Be calculated, be objective. Information is a two-edged sword. Misinformation can harm you, but good information can actually do really wonders for you.
Exactly. If a person wants to give the correct health to his or her bone, what things that person should do?
So start early. That's the first advice. Always from children, because obviously when we start early, we like education. You start early. Why schooling is happening? Because we want to educate early. So similarly for body health, start early. Be more outdoor. Children should be encouraged to play more outdoor games. More activity should be happening in children. Nowadays schools are also focusing on a lot of activities, a lot of sports being promoted, which is a good thing. Government has schemes of Fit India schemes and all these. Some schools are also being promoted as Fit India schools, which is a very good thing happening, because at early stage it's very easy to adapt the brain, adapt the mindset that we want to be more active. In the earlier generations, the sports was not that much promoted, which is comparatively promoted now. So start early, start being sporty or being physically active as a lifestyle, as a choice, as a habit is very important. Balanced diet is very important. Bone health, I would say, as I said, certain exercises, which are, as I earlier mentioned, that jogging, running, skipping, jumping, swimming, these are good for bone health. And then obviously good balanced diet, calcium intake, sunlight exposure, these are simple advices I would say.
And sir, do you nowadays, not only nowadays, people say that the person who has flat foot are not good enough for these sports, or they definitely have some kind of injury or any kind of difficulty in the future. Is it true or false?
So again, flat foot is again an overdiagnosed thing. Sometimes people just they fall prey to information, or someone who is not even who doesn't understand it. He would say that your foot looks like flat and should have got flat foot, and they get carry with this impression lifelong. And you see, consult a proper person, proper physician, doctor, surgeon who understands what is flat foot. Flat foot is again of 2 types: a flexible flat foot or a fixed flat foot. Fixed flat foot is a disease and a very small percentage of people will have a fixed flat foot, which will come to us early, and then we have solutions for it. Flexible flat foot is a very, very common problem. A lot of people have a flexible flat foot, their arch is a bit lower, and that doesn't debar them from any exercise. That doesn't debar them from any sports. They can play very well sports. Sometimes flat-footed people, yes, they do have more chances of foot pain. Being flat-footed, and if you're pursuing certain sports or maybe you are running or doing normal activities also, you have more chances of having foot pain. But then there are arch support, there are good qualified prosthetists, orthotists are available where you can get your arches made, and then those arches support the foot in a good way. Because the main problem with flat foot is the load on the tendon. The tendon which makes the arch, the posterior tendon, it gets stretched out and it starts causing pain if your arch is low or is falling down. So if you have a diagnosis made of flat foot, then good thing is not to avoid sports or not to be depressed or think that you can't play sport. You can play everything provided you have the good made insoles, shoes which support your arch. And I think you can do everything.
Hello viewers and welcome to MedGateToday TV Digital, and today we are at 7th edition of Thought Leadership Summit and initiated by OrthopedicDoctor, and we are the proud media partner of this event. So we are taking one media bite from the organizer itself, Dr. Vinay Kumar. So let's ask him, what was the theme of this event? How did he come to take this kind of event on such a beautiful city, the big city named Jaipur? And let's have a conversation. Thank you so much, sir, for making us one of the media partners of this event. So, sir, the theme of this event is Emerging Healthcare Beyond India. So, why did you choose this kind of theme to set up this tour?
So, healthcare has been now talked about quite a bit globally, and in India as well. So, if you see, in India, we have maybe the chains which get talked much about, right? But if you see the overall bed strength, India may have about 1.5 million beds, out of which Apollo, Fortis, they will not count more than a lakh and a half.
Yes.
So India is not about only commercial healthcare. India is beyond the border, so it is about Bharat as well.
Yes.
So usko leke we thought that we would get some ideas how to disrupt this and take it to beyond metros.
Yeah.
So that more and more people get access to quality care.
Yes.
That was the theme. And we usually do this in cities beyond metro. So like we have done this in Bangalore, we have done this in Chandigarh, we have done this in Jaipur now. So we take it to Hyderabad, which are not only the metro cities. So that more people should come forward and share their views about how to take it.
So you are aligning this theme of beyond metros to take up this kind of events not only in the metro cities but also apart from metro cities. Apart from this, sir, you just launched one white paper on cancer care. And there, your son also delivered a presentation where he talked about the RT machines. So how did you come up with such kind of knowledge thing, and what was the whole theme of inaugurating such kind of white paper on cancer?
So, like what cardiology used to be, the first speaker mentioned about that, cancer care is that to India. We carry a large burden of cancer. The problem is probably we are not able to detect it early, and that's how we land up with problem later. And like the data showed, we have hardly about maybe 1,000 linear accelerators for radiation therapy, whereas we need today 2,500 odd, and maybe by 2035, if you go by the developing country model, we need 4,000.
Yeah.
That's a tremendous gap for a country 75 years independent. We've not been able to reach even 25% of what we need. So this was an attempt to try and see and also geographically map it, so that it helps policymakers to understand where to put these kind of technologies where people don't have to travel long distance. You have to take 20 radiation doses, or you have to take 10 chemotherapy cycles. It's not easy for a poor person to travel that far. So that was the whole thing, that we can use that spatial mapping tool that we have developed using artificial intelligence for other specialties as well. Like the pharmacy, should I have more critical care center? This budget mein government said we want critical care center. Now where
they will
set this up? Cath labs, so that kind of thing. So it was just an attempt to show it through cancer because it was easier to do, and India has a genuine problem around it. So that was the reason.
And as you said that one of the first speaker talked about, and he mentioned that now cancer is the pandemic in the healthcare which India is looking forward to cater. So I hope, sir, the vision you started with, and this is the 7th edition, we hope in the future it will go beyond it, and we say a best luck and a very great success to this summit, and we're looking forward to hear all the great speakers which you have chosen. Thank you so much, sir.
Thank you. Thank you, Karen.
One picture.